So we as humans, we have some fundamental emotional and well-being needs that we have. I don't know if you know this, but you were a human before you were a service member and before you were a veteran. So these fundamental needs that all humans have are especially true for you. The reason it's important to talk about this is because these are the same fundamental needs that the way that we have met them for our period of time while we're in uniform, the way that we met these fundamental needs was taken away from us when we took off that uniform and became a veteran. The first of these needs is for connection. So just like all biological creatures, we have the same needs for food, water, and shelter. But as humans, we also have this fundamental need for connection. As humans, we're tribal creatures. We do our best when we're part of a group, when we have a sense of belonging. And what I've come to understand is it's actually even hardwired into our bodies, this need, this fundamental need for connection. So there's simple things that we can do that are pro-social or pro-connection behaviors that we can do that actually create a positive physiological, emotional, and in some ways even a spiritual benefit for us. When we engage in something as simple as being together in a group, laughing together with a group, experiencing something new with somebody else, these are all things that create a flood of oxytocin in our body. Oxytocin is often referred to as the love hormone or the bonding chemical. But the positive benefit of oxytocin and this return that we get from these pro-connection or pro-social experiences is that this flood of oxytocin also helps reduce adrenaline and cortisol in our body. They've actually shown that a lack of proper social connection has the same adverse effects on our health as smoking 15 cigarettes or drinking 6 or more alcoholic beverages every day. It'd be no secret to anybody that that kind of behavior is going to have some negative consequences on your overall well-being and on your longevity. But what they've shown recently is that even a lack of proper social connection, a lack of a sense of belonging, a lack of nurturing connection with other people that were part of their tribe, if we don't have that in our life, it can create some of the same or similar adverse effects on our health over the long term and on our mental health and well-being in the short term. The next need that we have is authenticity. And really these two needs, the connection and authenticity, are really closely correlated because I understand that if we don't have authentic connection, then we don't really have the benefits of connection. So if connection is permission to be part of a tribe, then authenticity is permission to be part of that tribe and show up, express our wants, ask for our needs, and show up just as we are without fear that it will cost us that connection. Authenticity means being able to show up as we are, not having to hide any part about us or part of our truth or part of our past. And this is a challenge that a lot of individuals in recovery face because we all have some behaviors or experiences in our past that we're afraid if other people were to find out about it, maybe they would think differently of us or it might affect the connection that we had with them. Veterans especially can struggle with this permission to be authentic because very quickly we realize that veterans are cut from a different cloth. You know, there's some unique things about us, whether it's our level of intensity, our dark sense of humor that we use to get through challenging times, or just this attention to detail that we have and this level of intensity. You know, we come from an environment where we're used to seeing everything through a lens of life or death. And in the civilian world, that can be a little off-putting. You know, we're used to seeing everything and doing everything down to a level of detail because what was ingrained in us is that the decisions that we make is either going to make us more lethal on the battlefield against our nation's enemies, or the decisions that we make with such attention to detail is something that might save or protect one of our fellow service members. Well, when this is the kind of intensity that's been ingrained in you through your service and you take this out to the civilian world, it can be very off-putting. So this is just one example of something that might be true about us as a veteran that we feel that we can't truly express in our new environment with these new connections that we're trying to make. The third fundamental need that we have is for meaning, a sense of meaning and purpose in our life. I used to think that a sense of meaning was just, you know, it was a positive thing to have. It could be a great thing to help provide direction in your life, maybe experience some joy along the way. But what I've come to find out is that the sense or this need for meaning is actually much more fundamental to our emotional and mental well-being. If you're familiar with the work of Dr. Viktor Frankl, he was a Holocaust survivor who wrote the book Man's Search for Meaning. And he started this field of study called logotherapy, which is a person's will towards meaning in their life. What I learned from his work is that a sense of meaning is also what provides our capacity to endure struggle or endure suffering. He says that a person can live through some of the most challenging times or some of the harshest conditions if they have a strong sense of meaning for why they're doing it. If we think back to some of the hardships that we experienced in the military, whether it was the long workups, the long deployments, a lot of the challenges that we did as we were training and preparing to deploy, there's a lot of hardship that we invited onto us or that we accepted. And we were able to accept it. We were able to endure through this suffering because there was such a strong sense of meaning with the military service that we were a part of. Well, the challenge is as you transition out of the military, you lose that sense of connection, that strong sense of brotherhood or sisterhood that we developed in the military. You often lose that permission or that feeling of safety in being your authentic self. This might mean that you begin to wear masks or show up as a version of yourself in new environments, hoping that you'll be seen and accepted as you are, or as you're presenting yourself to be. And then lastly, that sense of meaning. A lot of veterans or service members, they join the military because of the profound sense of meaning of serving something that's greater than yourself. It might be the family back home, it might be the community back home, it might be the country at large, but there's this profound sense of meaning that comes from that military service. And with that meaning comes a tremendous capacity to endure some of the greatest challenges. So if we look at that transition from military service, the loss of the sense of connection that we have, that we had bonded and that we forged through years of hardship with our fellow service members. You lose that ability to be authentic. You feel like you have to show up as a version of yourself in the civilian world so that you can be accepted or be enough for your new environment. And losing that profound sense of meaning that provides that capacity to endure suffering. That in and of itself, the loss of the way that you meet these three fundamental human needs is something that can be traumatic, is traumatic for a lot of veterans, and it really shatters that foundation for mental and emotional well-being. And what I've experienced is that it is because of this loss of connection, authenticity, and meaning that leaves so many veterans into their struggles with mental health or substance use disorder. Some of the same challenges that we were able to endure, whether, outside of the military, but those same life challenges that we can go through, the same relationship challenges, the hardships, the financial hardships, the family challenges that are all going on back home. We can live through that and we can endure these things because of that profound sense of meaning and the connection that we have that helps foster our emotional regulation and our well-being internally. When we lose that, then even some of those same hardships that we experienced and lived through while we're in the military can now become obstacles that are too great to surmount. And this is a challenge that a lot of veterans experience, and it really leads individuals into those struggles with behaviors or with substances. I share this with you, and the reason it's so important to understand through this lens of this connection, authenticity, and meaning is because a journey into recovery and a journey back to who we once knew ourselves to be needs to address these fundamental needs for the connection, authenticity, and meaning. And a lot of veterans, they'll go to support groups, they'll go to treatment, they'll go and try to find some tools or resources or an environment where they can grow into the person that they want to become in their recovery. But if it's not looked at through this lens of some of the fundamental needs that we lost through transition, and the fundamental needs that we once met in our military service that now we might be struggling with meeting, if we're not addressing these fundamental needs in our recovery journey in a specific way that serves veterans, that connects with the veteran experience, then there's always going to be some additional friction or additional challenges that get in the way of us and the growth that we want to experience in our life and in our recovery.